had technical difficulties, so I had to pause it and then delete some stuff, but we're continuing. Okay, so with that in mind, there's an entire hip kit simply named, which you can do all these things while maintaining compliance of these precautions. So now that you know what a hip kit is, let's talk about what is all included. A hip kit usually consists of 4 different pieces of adaptive equipment. This equipment is to help people adjust around their new level of function and to be as independent as possible. There's the picture. The 4 traditional pieces of adaptive equipment in a hip kit are a sock aid, a reacher, a shoe horn, and a long-handled sponge. 3 aid in dressing tasks, while 1, the long-handled sponge, aids in bathing tasks. For the sake of time, though, I will only discuss information regarding the sock aid. The American Occupational Therapy Association writes in the article, Daily Activities After a Hip Replacement, that the sock aid is used to position and draw a sock or stocking onto the operated leg. A sock aid has a wide mouth opening with 2 strings attached to the end, pictured here. And the process of the sock aid is as follows. Patients first put the sock over the opening. They use the 2 strings to lower the sock aid to the floor. They thread their foot through the sock opening, and lastly pull the string slowly upwards like a fishing net to fully place the sock onto their foot, and they simply repeat with the other. It sounds simple, but most people have difficulty their first couple of times. But with practice and supervision of an occupational therapist and or assistant, all patients come to love their sock aid as well as their other hip kit equipment. In conclusion, the sock aid is only one of 1,000 pieces of adaptive equipment on the market to help patients regain their independence. I've discussed what a hip kit is, what is included in a hip kit, and briefly touched on the purpose and how to use a sock aid. Hopefully you'll never have to apply this information for yourself or your loved ones, but if so, you know you're in good hands and that you'll be independent and not